Hello everyone, and welcome to our TEOXANE webinar entitled The TEOXANE Approach Tailored to Perioral. Today we are delighted to have Dr. Patrick TREVIDIC as our speaker. I'll introduce Dr. Patrick TREVIDIC. Dr. TREVIDIC is a renowned French doctor. He is a plastic reconstructive and aesthetic surgeon based in Paris, and he is also the chairman of the surgery department of the Sainte-Anne Hospital in Paris. I'm sure you've seen some of his publications. He's published more than 50 peer-reviewed scientific articles and has been a key investigator in several anti-aging studies. Dr. TREVIDIC is the scientific director of the Expert-to-Expert group and is also the scientific director of the Face-to-Face Congress. Dr. TREVIDIC is a renowned professor and lecturer in surgery in several universities and medical schools in France and across the world. So we are very happy to have Dr. TREVIDIC giving this webinar today. Please note that you can ask all your questions as we go during the webinar in the Q&A section. Dr. TREVIDIC will answer those questions in the end, but it's better if you ask them as we go so that I have time to read them all. And also please note that Dr. TREVIDIC will ask you some questions during 3 different polls during his presentation. So please feel free to interact and have a great webinar.
Thank you, Fabienne. Thank you very much for this warm welcome. Welcome to everybody from Paris. And my topic today will be my favorite one. It's on lips and perioral approach. When we are looking to this lips and perioral approach, we know that we will face, a lot of issue, because if we are looking to the marketing study, we know that this market is globally increases a lot. This is the second fastest growing, and this is one of the first demand. Now it's just the third one, just after worldwide, the cheekbone and the tear trough. But it's growing so fast that I think in the future, perioral market will be the second one. It's a major demand. It means each time you will do an HA injection, for example, in mid-cheek, half of your patient will ask for something around the lips. And what is also very interesting with this marketing study we did with TEOXANE is that you see that the treatment is totally different, and we have a lot of demand regarding the age of the patient. So it's a transgenerational, demands among all these patients. But on the other side, on one side, we have a big market, but on the other one, we have the most complicated area published. It's not the first, area of vascular compromise, but it's the first area of aesthetic complication and also serious complications. So this is the first area for that. So we will need to deal on one side with a big market growing, so you want to jump in, and on the other side we have a lot of complication or bad outcome. So we have a big issue, and we have to understand why we have this issue, to understand how we can do a reliable and better injection. This is the target of this webinar. So for that, we know that the patient expectation is going from a young patient who want to do a beautification. So they come to your office and say, hey, Patrick, I want to plump my lip. But on the other side, you have older patients where they want to rejuvenate their lip. And so they see that their lip change with the aging process, with wrinkles, with lines. And so they want to rejuvenate their lips, and they want to go back in the aging process. And this is what we discovered when we did, this marketing study. And you see that on the left side of your screen, you see the patient around 18. They want to increase the red lip. And on the other side, over 65, what they want to do is to treat, you know, the barcode. And when they are 50, they want to treat the barcode, but also the marionette line. And when they are around 35 to 50, as you can see, they want to do a soft volume. And so this is the main demand of the patient. And so when you ask them, what do you want to do with your lips? They will say, when they are 18, they say, Patrick, I want to plump my lips. And when they are 50 to 64, they say, I want to get rid of my vertical lines. So I want to smooth all this area. So how we can target all these demands in a big market, but on the other side, you know, a lot of complication and a lot of bad outcome. This is a case of a young patient coming to my office, and I did just an injection of 1 ml, and this is the outcome 1 month after. It's a young patient. She doesn't want to change the shape of her lip. She is very satisfied with her shape, but she wants to have more red lip. And on the other side, you have this older patient. She came to my office and said, hey, Patrick, I lose my lip a little bit. I lose my volume. I have some little wrinkles everywhere. Could you fix something for me? And so I treated this patient, but it's totally different from the previous one. So this is the two areas of demand. And in the middle, you have the average, but they don't want that. They don't want these big lips that look non-natural. And in France, we have, unfortunately, in the past, a very famous actress that did her lip with permanent fillers. And all my patients come with her photos and say, I don't want the lip of Emmanuel Boyard. So if we want to treat these lips, you will have to go through the TEOXANE approach. What is the TEOXANE approach? TEOXANE approach is based on 3 pillars. First, A, it's anatomy, patient assessment, aging process. So A, it's the first letter. Then you have the technique, and you will see that there is not one way to go to Rome. So you can take the way you want, but you have to be safe and you have to have a good outcome. And the third pillar, and it will be the last one, is the product. It's very specific because TEOXANE follow me on this TEOXANE approach to put the product at the end and not to put the product at the front. So for me, A, it's the first letter, and it's the first thing you have to know when you do a lip injection, a lip beautification. T, it's your technique. I don't want you to change. I want to show you some of the technique I use in my office, but I don't want to change. If you are happy with your technique, you keep it. And at least you think about the product you will use regarding what you want to achieve and what is your injection technique. So this is the way how we think with TEOXANE, and this is the way I will follow during this webinar. So the last things we have to think about is the fourth dimension. The fourth dimension in physics, it's time. But for us, and for lips, and for face, the fourth dimension will be the movement. So you will have also to deal with the movement. Sometimes you see a beautiful lip around you, but as soon as this lady is moving, is speaking, is smiling, you say, wow, she did something. Why? It's not sometimes because of the volume. It's because the movement is not natural, because the movement is not an easy and a smooth, movement. It's something that, stiffen your lips. And so you don't want that. You want something nice, but something also natural. But the main question is, do you want to get that? Do you know what it is? It's a patient who gets a lip injection. And this is the picture of this patient 2 hours after. And this is the patient 6 hours after. what happens to this patient? Or what happens to these patients few days after an HA injection in the lips? Because you did an HA embolism. And why? It's because you didn't get in your head, you know, in your brain, the anatomy of this. And because you don't know your anatomy, this patient, as you can see here, is moving, and 10 days after, she gets this because she did a vascular embolism in the lateral nasal artery, that is an artery connected with your facial artery. So the knowledge of the anatomy will bring you the safety. And this is very important for the lips because lips have a very complex anatomy. We published 3 main articles on lip anatomy in the PRS with some of my colleagues in 2015 and 2019. If you are looking to the anatomy of the lips, what you discover is, if we go step by step, you have the first layer that is the skin. The skin has different thickness regarding your ethnicity, regarding your age. And just under the skin, you discover a layer of fat, unless if you are very old like this cadaver, you have no fat. This layer of fat, if you remove this layer of fat, you discover a layer of muscle. And this fat has different, also a variation in the thickness. The muscle, you have one big muscle in the middle, the orbicularis oris, and 18 muscle connected, you know, with this main muscle. So if we are looking to this main muscle, the orbicularis oris muscle, you have 2 parts. You have a pars marginalis and a pars periphéralis. And you will see that these 2 parts will do something different with the movement. And it's like a sphincter around your lips. It creates the movement of the lips depending which part is moving. And this muscle has a hockey cross shape. You can see here, you know, the red and the pink of the muscle. So each time you want to reach this muscle, you know that this muscle touches the skin just here, at the vermilion border, at the cupid's bow. So if you want to do toxin, this is the target where you will put your toxin each time, at the border between the white and the red lip, and where are the motor end plates. Surrounding this muscle and blended with these fibers, you discover the depressor muscle, and the main one is the depressor anguli oris, with a deep bone origin on the mandible and the skin insertion at the commissure. And this triangle could be smaller or wider and create the marionette lines at the upper part. So this muscle pull down. And when you are looking, when you do toxin, and when you are looking to this muscle is not located, you know, at the front or at the back of the marionette line. This muscle, the body, is just at the middle. It means the marionette line, this is the muscle, is just here in the middle. So when you will do your toxin, you have to reach this muscle without reaching this one. That is the depressor labii inferioris. And this muscle has its bone origin just under the body of the depressor anguli oris. So my advice, if you do toxin, will be to be at the commissure, behind the marionette line, very superficial or very deep at the border of the mandible, inferior border. We have more levator muscle of the lip. You know why? It's because we are on Earth. And on Earth, it's very difficult to go up. It's easier to go down. So you see the 3 main muscles, and the last one gives the levator labii superioris à l'aquae nasi, give the gummy smile. So all this muscle here on this anatomical view will lift the corner and the lip, the upper lip. But you have another muscle that elevates the lower lip. This is a mentalis muscle. This mentalis muscle has the bone origin just under the incisive and the canine, and is going straight, it's in green, and going straight to the skin. This pull backwards your chin, and this elevates your lips. Like this woman, if you relax with toxin, look what happens to this lady. She gets, you know, she protrude her chin. So when you want to protrude the chin, the first step is to do toxin. Like this guy has a strong mentalis, as you can see. If you are looking to the anatomical dangers, and this is the first target, the first target is the arteria labialis path. Where is this artery? We know that there are a lot of anatomical variation, but this arteria labialis is following a path through the lips. So if we want to know where are the danger, where is this artery in 3D? Because you can be in a dangerous area, but in a safe layer. So when we talk about areas, it's not a good word for injection. We have to think in 3D, to think that your anatomy is in 3D. So you can be in a dangerous area, but in a safe layer. Look at this artery. This is the fascial artery, and this is the real diameter of this artery, a big artery filled with silicone, like we do, you know, when we do cadaver dissection studies. And we follow this artery, and this arteria labialis is giving, you know, an arteria labialis inferioris and superioris. So the arteria facialis give an arteria labialis superficial in 1/3 of the lip, lateral one, and after cross the orbicularis oris and follow the mucosa, under the mucosa, and the average placement of this artery is between the red wet and the red dry lip. So if I pull down this mucosa, you can see here the arteria labialis, and here it's the red wet lip, and here you see the accessory salivary glands. We give the wet mucosa. And so this artery crosses the muscle at 1/3, 2/3. So here you can see the path of this artery. Here you see again the submucosal placement of this artery, another cadaver here crossing the muscle. And for the arteria labialis inferioris, it's the same, but it's not a danger for your injection unless your marionette fold injection, because it's a deep artery. If we are looking to a transversal view of the cadavers, you will see here one part where the arteria labialis cross the muscle, here under the skin first, then cross the muscle here at 1/3, 2/3, and then after crossing the muscle in this red circle, will be in a submucosal position, like you see here with the cadaver slice, you know, we do on these lips, following each time what happens to this lip. So this is your anatomy. This is the danger of your lip. And each time you will have to focus on this artery. To summarize this danger, if you take a picture of a patient like this, and you divide the lip in 3 parts equal, you will have first your artery. The first part will be in a subdermal plane, here, just here. Then cross the muscle here, and then will be in a subcutaneous, submucosal layer. But it's not just here. We know that it's bigger. The box of danger could be in the muscle, just above this line or a little bit under this line. The sensitive nerves are very well known. You have 2 big nerves. You have the infraorbitalis nerve, just here, and this is the infraorbitalis nerve. Normally, the classical location is on the mid-papillary line, but it's not there. It's a little bit medial to this mid-papillary line. And immediately after the foramen, because it's going outside of the bone, it's divided in a lot of twigs, as you can see here, with your levator labii superioris that protects this muscle. And just under, you see here the foramen and a lot of twigs coming outside. And that's the same for the mentalis. Going outside of the foramen, this is the trunk of the nerve, and you see a lot of twigs going to the inferior lip. So as you can see here, you have a perfect view of the anatomy, but you have the movement. Don't forget the movement. If you are looking to the orbicularis oris, who give you the movement of the lip, you will see that if you move some part of the lip, like this one, that is the pars periphéralis, you will protrude your lips forwards. It means you will do this movement with your lips that is very important. You do like this when you use your periphéralis parts. If you do only the marginalis part and you use only this part of your orbicularis oris, you will clench the lip. So you will tighten the teeth. So you will do this movement with your lips. And if you use all the muscle together, then you will purse the lip. So regarding the different part of the muscle you will move, you will do a different movement. And this is why when you do injection, you can change something in the movement depending where you put your filler. So if I summarize, and this is a very important drawing for you, if you summarize the path of this superior labialis artery, you see that 1/3 laterally, your arteria labialis is just under the dermis in the fat compartment of the lip. Between B and C, your artery is crossing the muscle. And with B and A and B area, your artery will be just under the mucosa between the red dry lip and the red wet lip here, but it's not really here. There is a box of danger because there is anatomical variation, and so this red spot here could be a little bit in the muscle, could be a little bit below, or a little bit above. 2 millimeters above, 2 millimeters below, or 2 millimeters in the muscle. This is a beautiful study published by a lot of anatomists, you know, in the PRS last year. So you can have this article very easily. What is the aging process of the lip? A lot of you will tell me, my lip during my aging process is decreasing. I lose volume. It's not true. You increase the length, you decrease the thickness, and you inverse the vermilion. But the volume, the global volume of the lip doesn't change. What you have, and this is a study published by 2 of our experts, Pena and Ibler, they prove that there is a volume redistribution, but there is not a loss of volume. So we have also, because we see during this first part, A with the anatomy, A with the aging process, but you have also the patient assessment. It means you have to deal with men and women, and you see here the difference regarding the gender, but we have also to deal with also the ethnicity of your patient. And this is the lip ethnic variation. And because now we are more than 2,000 in this webinar, I'm sure there is people from APAC or Afro-American people. And we know that the Caucasian ratio is never more than 1. It means the upper lip is never bigger than the lower lip. This is not the case for Afro-American people. And this is also not the case if you are looking to Asian lips. You can have a ratio over 1. But if you do Caucasian patient, don't forget this, because if you put everything, all your syringes in the upper lip, your upper lip will be beautiful, but your upper lip will look weird because your upper lip will be bigger than the lower one. So keep in your mind the ratio regarding the different ethnicity. And now I will ask you a poll, because I will not be the only one to work. And so I will do a poll with you. I think you see on your screen a poll. If you can answer to this question, that will be great. And I will share with you after all the outcome of this poll. So lip volume changes with the aging process, the ratio, marketing survey, and also the anatomy. Can you poll on this? Can you do the poll? Yes? I see some of you. Can you vote? You have still 15 seconds to see that. It's okay. So I want to share with you. I don't know why it doesn't work. Okay. So you can see here the outcome. We will share together. So this is interesting to see how you answer to this poll. Thank you very much. And we are going to see the other chapter. We did A. Now we'll go to the T, the technique. And it's very important for the technique to have, a view of this technique. Why we have such differences regarding the technique and the different people. Why we have a big market, and on the other side, we have a lot of adverse event and bad outcome. It's because, in my point of view, lips are not like other facial area. What does it mean? It means that here you see that normally the structure of the face will be bone, deep fat, muscle, superficial fat, and skin. This is what you have in your mid cheek. This is what you have everywhere. But if you are looking to the lips is very mobile. It's like something that is moving from one part to another. So each time you will do an injection, and you will have to follow this rule, each time you place a filler somewhere in the lip, you will modify the shape of the lip. Look at this injection in blue. Here, you inject only the Cupid's bow. It's pulling forwards your vermilion border, but it will not change anything regarding the size of the red lip. A little bit here, but not a lot here. If you put products under the white lip, you will inverse the lip. If you put your products under the mucosa here, you will reverse the lip. And if you put your product in the middle of this structure, that is, at 360 degrees, you will plump the lip. So each time you put a product in one part of the lip, the first rule is you will modify the shape, and you will have to choose where you want to put the product, but what you want to do with your patient. So if you want to plump the lip, I will put my product in the middle. It will not change the shape, it will increase the size. But if you put the product in the white lip or in the cupid's bow or under the mucosa, you will change the shape of the lip. The second rule is if you put product at the anterior part of your lips, the product will stiffen a little bit the lip, will change a little bit the movement. So be very careful each time you put product in the cupid's bow or under the white lip, not to put too much. Even with RH product, you can stiffen a little bit the lips. And all stiff products will change the lip movement. It means if you put a high cohesive product, and we will see that with the third part of my talk with product, you remember TEOXANE approach, A, T, P. So we will see that if we put a P product too stiff, the movement will change. You will stiffen the lips. So let's start the techniques. First, plump the lips. You remember, each time a lady is coming to your office and say, hey, and you discuss with her, and she say, oh, I love the shape of my lips, but they are a little bit too thin. In this case, because you don't have to change the shape of the lip, you want to inflate this lip at 360 degrees. In this case, you will do an injection in the center of the muscle. But you know from the anatomy that in the center of this muscle, and mainly between 1/3 and 2/3 of the lip, you will find the artery. So if you do an injection in the center of the muscle, my advice, like this lady, where I put, 1 ml of product here, it's a RHA Kiss, or you see the lady on profile after 1 month, or you see this lady with 1 ml of product in the center with RHA 3. And for this lady, what I did, I use a cannula, a commissure injection here, and I put my product in the center of this muscle, and I increase at 360 degrees, but I don't change the shape of the lip. Look at the lateral border. She's very thin here, and here it's wider. So I don't change the shape of the lip. But some patients arrive to my office. They are not very, very young, but they are a little bit older, and they lose around 30, 35. They lose a little bit of the lip. And you remember the aging process. They inverse their lip. So they come to my office and they look at me and they say, hey, Patrick, I want to change a little bit my lip, not too much. And so they put their fingers on their white lip and they press on the white lip. So you see a little bit more of the red lip. And this action is exactly the eversion of the lip. And to do this eversion of the lip, you will have to put your product in a submucosal position. But you remember, A, your anatomy. This is exactly where is your arteria labialis superioris and inferioris. So if you want to everse the lip, to rotate the lip, what could be the option regarding the technique? The technique that will be the safest one will be to do an injection with a cannula and to put your cannula in a submucosal position here between under the red wet lip, very important, not the red dry lip, because you will not everse totally your lips. And I use for that RHA2. Why? We will discuss about the product, but this product is very forgiving product. It means if you do a bump, it's very easy to smooth the bump. And so you will do this injection with RHA2 slowly you will inject your RHA2 under the mucosa. But I was not very satisfied with this technique. Why? It's because with a cannula, it's very difficult for me, and perhaps for you, I don't know, but perhaps you have a tip and tricks and we can share together. But when you withdraw your cannula on each part of your lip, you don't know how much product you put in the middle, in the medial part, or in the lateral part. So I was not very satisfied, and it's very difficult to control the right position of the cannula when you use it by this way. So I tried to find a new technique. You have to learn this technique because it's not an easy technique, but this technique has been published in DermSurg in January, and we can share together this article. And the name of this technique is French kiss technique. The idea was to put my product, as you can see here, in a submucosal position, but to avoid this superior labialis artery. And you know that this artery could be here, could be here, or could be here. And I wanted also, when we started to do this technique 3 years ago, we wanted to be very precise. The only way to be precise is not to use a cannula, is to use a needle and to do bolus, because each bolus, you know where you are and you know which amount of products you put. So let's share with you, you know, this presentation where you see here the eversion. First, you have the disinfection. Here you see the disinfection with the drawing. Three.
One at 1/3, another at 2/3, and one more point in the lower lip at 1/3.
I do the disinfection.
After sterilizing the area, the patient opens their mouth to insert our non-dominant index and place it just on the wet red lip. We then introduce the needle, which will touch the pulp of our index with its tip.
So you see this placement
And we inject slowly
is very, very safe. Because it's above the danger. And my pulp of my index control the position of this product.
This will avert the lip. It will create a bump under the mucosa, under the wet red lip, far away from the border between the wet red lip and the dry red lip. Then the fourth step is to do the same for the other points of the upper lip.
So as you can see, I put 4 points in a submucosal position in the upper lip and 2 at the lower lip.
0.2 or 0.1 millimeters of product, depending on what result the patient wants.
So for a classical one, I will put 0.2 in the middle, 0.1 on the lateral side.
The lower lip to create the 2 bumps lateral to the midline. These 6 bolus points are very safe with regards to the arteria labialis position. There is no artery under the wet mucosal side of the red lip.
And after, because I created 6 bumps, I will do a massage. Because it's RHA2, it will smooth everything, because RHA2 is very soft product. And you see, I never do the upper lip without the lower one.
When we finish, we have 6 bumps under the wet mucosal side. Following injection, massage bump, we use RHA2, which spreads evenly. The patient must never leave the office with a bump that can be felt with a finger. The advantages of this technique are that the injection is not painful
So remember the first rule of every meeting and every webinar. You know what is this first rule? Never trust the speaker. So I will show you now a lot of outcomes with 1 ml of products. Here you see what you can achieve. This patient has a little asymmetry, and so it's not the face, because you can have this outcome if you plump the lip or if you do a Cupid's bow injection. But on profile, look at the profile. The profile, it's exactly what I want to achieve. You everse the lip, it means you rotate the lip and you create a shortened white lip. You didn't create a shortened white lip, really. If you make a measurement here, it will be the same length than this one. But because you rotate something, you have, you know, you achieve a rotation and you smaller the white lip. Look at this patient. It's another case to show you how you can adapt this technique. This patient come and say, I did a lot of lip injection, but they never succeed to everse the lateral part of the lip. This is very difficult to everse the lateral part. In this case, you remember, I do 2 bolus in the upper lip. And in this case, I put more product on the lateral point here than on the medial one. Here, another case with 1 ml of products again. You see this patient, a very thin lip. I want to show you that if you place not a lot of product, but if you put the product in the right position, you will achieve a very nice outcome, even with a small amount of product. You can put more, I agree with you, but it's just to show you a lot of examples. And in our publication, we did a clinical study to prove that. So this is another case to see the rotation of the red lip. Male patient, now I have a lot of male patients asking me, you know, to everse their lip, because they know that this French kiss technique that you have to learn. Don't start this technique without learning this technique on a cadaver or to train with somebody who knows this technique. But it's a very nice technique because it shortens the white lip and it everses the red lip. Another guy, another woman here, look on profile. And you can also treat the asymmetry because the bolus you will do here will be different. You will put more on this side than on this side. So it's very easy to treat, you know, and this is a case with multiple injection in the lip and around the lip. If we go to the vermilion border, the Cupid's bow, you can achieve very good outcome. And moreover, if you have a little lines here. But if you do this, don't forget, look at this patient. She wanted only to have Cupid's bow injection. And she wanted to have a huge volume in the Cupid's bow. She bring me photos. But look on profile. On profile, you push forwards the vermilion border, but you don't treat the red lip. So if you don't put products here, your lips will look like this, will look like a duck lip. So don't put too much in the vermilion border. Same with this patient. Look, the Cupid's bow has been projected forwards, but the red lip doesn't change. So you have these 2 movements when you do only injection in the vermilion border. That is very easy and very safe because there is a virtual canal inside here, this vermilion border. So if you inject only here, you will push forwards your lips and the red lip will be still backwards. Here it's a case where I do only an injection in the Cupid's bow and you see that it changes a little bit the size if you put too much. White lip is for me the worst area to put HA filler to increase the lips. Why? Because if you put too much in your white lip, you lose your concavity and you create a fish mouth. So look at this lady. She had only white lip injection. It's easy because you use a cannula, you use a needle, but it's easy. But it's not like this yet that you will treat the fine lines, the barcode. If you want to treat the barcode, my treatments will be the blanching technique. The blanching technique has been published by one of my friends, Patrick Michels, a Swiss guy, and you have to put your needle at less than 20 degrees from the dermis. And you have to use RHA1, a very soft product, to avoid the bump that you had before, you know, with Skin Booster. So you have to do really a strong massage at the end to erase the bump, and don't let your patient go back to their home with any bumps like the French kiss technique. So this is the products I will use. This is an example of this barcode technique, you know, with blanching technique. Another case where I did not only here, but I did with the blanching technique also the periorbital area. Another case with blanching technique again. So I will ask you some questions on techniques, and we will share a new poll with the technique. And could you ask to this question? So you have only 2 injection. If you inject in the white lip, yes, if you inject in the white lip, you will, and the only tool to do an injection in the lip is the cannula, because there is some cannula guys or cannula ladies. So if I show you, no, if you do injection in the white lip, sorry, but you will not everse the lip, because you will lose the concavity of the lip. You will inflate this lip here, but the red lip will not rotate through the axis. So this is very important to understand that if you do your white lip injection, you will have immediately after, you will have a white lip that will look a little bit stiff and also will not have the good movement. So let's start again for the last part of my talk, that don't forget to treat the perioral area. So you will need, you remember, RHA2, RHA3, RHA1, RHA kiss, and sometimes RHA4 for the perioral area. So this is some case with RHA4, as you can see here. And what are the products? You want your lips to smile. You want to have a good movement of your lips. For that, what could be the best product to inject? The best product to inject will be your own HA. What your own HA look like? It looked like you see on your right side, you see a long chain of HA with weak bond to maintain the 2 lines together during the movement. So because of the weak bond, your chain will not break. Your chain maintain, you know, the structure. If you are looking to the classical HA you inject, or the other one, you have a high modification degree, because to maintain the structure and for the HA to last longer than your classical HA you have in your body that lasts few hours to 1 day, you will have to create strong bond between long chain and short chain. And you know why you have short chains? It's because at the beginning of the process, the company receive long chain, but because they dilute this product, they get in the vial long and short chain. And if they don't remove the short chain, you will have a mix of long and short chain and a cross-link with BDDE with a high modification degree. This is why TEOXANE works on a new way to do the HA to maintain, you know, the natural HA, but could last a little bit longer. So we have to put BDDE, but the modification degree, look, it's between 2 to 4%. It's a lot of long chain, not a lot of short chains, and so it can move. It's a product that could move, and we have some, I can't develop everything today because I have just 1 hour, but to understand that, we create new parameters around this long chain to see if this HA will move. And we show that in clinical study published, for example, with Emma Sundaram and other, injectors, that this RHA scale has, preserved the network and follows the movement like your own HA. So this is the RHA. So if we look to this lip collection I use in my office, this is the lip collection I use. I use RHA1, you remember, for the barcode. RHA2, it's for the contour. RHA3, it's to plump your lip. And RHA Kiss, that is a stiffer one, that is a classical one, is the one I use only with young women who want really to plump a lot their lip. So this is my algorithm. For the barcode, I use RHA1 in a blanching technique. For the lip contour, I use RHA2 or RHA3. And for the commissure and the nasolabial fold, I will use RHA3 or RHA4 to treat that. So this is the lip unique collection. And with RHA, you have a lot of products for each demand of the patient, because the demand at 20 will be not the same as the demand at 50. So if you use only one product, you will use perhaps the wrong product. Perhaps you will not use it as you want, because you have to get, in your toolbox, all this HA to answer to all the demand you will have. A last poll that we will do will be on the product, and so I will launch, this poll to see if you follow this. RHA is new dedicated to the movement because, so you have to answer if it is because of the lot of short chains, long chain. Remember that short chains create inflammatory process also. It's biphasic products. So RHA is a product dedicated to the volume. No, you're right. RHA2 is dedicated to the contour. Yes, you're right. If I share with you all this poll, as you can see, a lot of you use very well, all these products. So thank you very much. And we will go on. I will stop, this poll, and I will go back to my screen. So
great. Yeah. Thank you so much, Dr. TREVIDIC. It was an amazing presentation, and we actually have quite a lot of questions because we had more than 2,400 participants today. So thanks everybody for being here. So of course, I cannot ask all the questions of the 2,400 people, but Dr. TREVIDIC will answer them offline, but we'll still ask a few. So you have a lot of questions on the French kiss technique. So the first one that has come up quite a bit is, why do you not inject intraorally rather than from the cutaneous side when using your French kiss technique?
This is a very good question. It's because if I'm going through the mucosa first, I will cross the mucosa, and so I will have more bruising than by crossing the white lip, and it's more painful first. The second point is because I do a bolus and I do a massage, I will cross the mucosa, and so I have the risk that the HA will go through the little hole I did in the mucosa, and so it will go away. And the last point is I'm at the front of my patient, so it means I'm behind my patient. And if I want to do injection in the mucosa, I need one hand to avert the lip to do that. But if you do through the white lip, you don't have to do this maneuver. That is not easy when you do it. But I know that some of you use my technique by the eversion. So remember, you have to be more than 2 millimeters above the line between the red wet and dry lip, or more than 2 millimeters, because if you are below this limit, you can be in the artery. And some of you use also RHA3 and not RHA2, and they told me that it works very well.
Great, thank you, Dr. TREVIDIC. We actually have some more questions on the French kiss technique. And the question is, because you have to go through the lip with your needle, how do you control the depth of penetration to make sure you're safe?
This is a very interesting question. This is why I put my finger in, you know, on the mucosa. The pulp of my non-dominant hand will be inside my lip. And so when I go with my needle through the lip, to be sure that I am just at the contact with the mucosa, I feel on the pulp of my index, and you can do it on your first patient. If you don't feel the tip of the needle on your pulp, if you don't feel, you know, the sharpness, you don't cross the mucosa. But this is why you have a learning curve, but you feel a little bit the needle on the pulp of your index. Sure, you are in a safe layer because you are above the danger, but sure, you are in the right plane. It means under the mucosa, because you feel the turbulence of the HA you inject under the mucosa on the pulp of your non-dominant hand. It means the pulp of your index in the mouth is very important to control two things. First, that you are above the danger. It means above the 2 millimeters limit of between the red wet and the red dry lip, and to control also the position of the product under the mucosa and not in the muscle or in a subcutaneous plane.
Great, thank you. I think we have time for last question. And actually, this one is interesting because it's a little bit in link with the webinar you gave yesterday, in the sense that here the participant is asking, if you compare to all the other zones of the face where you can inject, would you say that for the lips, injecting with the bolus technique is safer than with the cannula?
Oh, it's not a tool that is safer or not. It depends what you want to achieve, because if you use the right, very safe tool like a cannula, but you don't achieve a good outcome, it's not really a good thing. So you will have your tool depends first on the dangers, but your tool depends also on the outcome you want to achieve. For example, I use a cannula in a periorbital way for the tear trough, not because of the danger, because there is no danger in the tear trough, but because of the swelling you can have, the bruising you can have. But when you do that, I'm sure that with the needle, it's more dangerous than with a cannula. It's for that we have to know the layers and the dangerous layer. There is no dangerous areas, there is dangerous layers. This is my fight against, you know, some anatomical publication who say there is no safe zone. No, I agree with them. There is no safe zone in the face. but there is safe layer and there is dangerous layers. So think in 3D and not in 2D. In 2D, this is the classical anatomy. This is the anatomy in your book. This is not for injection. Injection is in 3D. So when you are like me, injector and also anatomist, you know that you can inject with a needle in a safe way, like the French kiss technique.
Great, thank you so much, Dr. TREVIDIC.
Thank you, everybody.
We will close the session now. Thanks to the 2,400 participants today. It was great, lots of interactions. You can see here on the screen the upcoming webinars. You can find the links in our Instagram, TEOXANE Pro. So looking forward to seeing you all on the 8th of April. Thank you so much.
Bye-bye from Paris.
Bye.